Today, we'll take a look at 5 more of history's most brutal torture devices to see what we can learn about human anatomy. And please note, any discussion of torture is carefully contextualized within a lesson on human anatomy for the purpose of education, in accordance with YouTube's own terms and conditions. First, we set the time machine for 16th century Europe. Where unfortunately, it was considered a crime for women to nag, scold, or spread gossip, punishable by wearing the scold's bridle.
The scold's bridle resembles an iron cage and has a padlock in the side in this example, which only the key holder can open.
Humans are endlessly creative when it comes to inflicting pain on one another, and my heart goes out to the women who suffered this fate. Thanks to the Welcome collection here on YouTube for the following clip.
The bridle would have been worn for a stated duration, probably several hours, aims to humiliate and cause great discomfort and pain to the wearer.
These iron devices were fitted with an internal metal plate designed to slide into the mouth and depress the tongue, often with a spike, making it impossible for the wearer to speak or communicate normally.
And this bit goes on top of your tongue.
Yeah.
So when that goes on your tongue and you're paraded around in front of your neighbours.
The rigid iron insert could easily knock out a tooth, while one of its coarse edges could cut the mouth or tongue, causing bleeding and possibly infection. Once in place, the device would fatigue the muscles in the mouth and tongue, making it more difficult to swallow while causing increased salivation.
It is very heavy.
These factors have the potential to impede the normal function of the airway, and therefore choking strikes me as a distinct possibility.
So now with this rope through there, quite literally leads you by the nose. Yeah, it's supposed to hurt.
The added weight of the iron device would slowly fatigue the muscles in the neck, and one sharp tug while the wearer is being paraded through town could easily strain the muscles, ligaments, and tendons located there, and possibly even damage the vertebrae, intervertebral discs, or nerves of the neck. I would imagine symptoms similar to that of whiplash, though in this case the movement would be unidirectional, in the direction of the chain, and not forwards and then back, or vice versa. Strains to the sternocleidomastoid muscle and the alar ligaments in the neck are common among whiplash patients, as well as lesions to vertebrae and vertebral discs and cervical nerve tissue. The participatory nature of this form of torture, with onlookers throwing things at the shamed wearer, would worsen the experience considerably, not to mention the psychological trauma inflicted upon them as well. So, what if we go back a little further? Oh, right. The Toyota Corolla of torture devices, the good old rack. Many variations of this device have existed throughout history, most commonly a wooden frame, some lying flat, some with one end lifted at an angle, with rollers at one end, or both ends leveraging chains and shackles, or just plain old rope to pull the limbs of the victim until their joints dislocate, or worse. But we'll get to that in a moment. This device was commonly used to elicit information or confessions, as it left the victim's vital organs intact and wouldn't cause severe bleeding until very late in the racking process, rendering it painfully non-lethal in normal use. Take a look at this animation from the Simple History YouTube channel. As the torturer turned the rack, the victim's connective tissue would gradually sustain greater and greater stress at all the major joints throughout the body. Tendons and ligaments beware. In medicine, this type of force is called traction, pulling on or stretching a certain part of the body in a specific direction, typically away from the midpoint. Orthopedic surgeons commonly use traction to reduce fractures and dislocations. That is to say, we pull, quite forcefully sometimes, the displaced parts of the bone away from each other so that we can realign them before. Okay, That's an exaggeration, but you get the point. Sometimes when a fracture is not too comminuted, closed reduction via traction, supported afterwards by some type of orthotic device, may be sufficient. Unfortunately, that's not what's going on here. With the hands and the feet tied, the force of the crank would be translated through the wrists and elbows, ankles and knees to the larger joints, the shoulder and the hip. All of these are synovial joints, which indicates that there is a space between the adjoining bones known as a synovial cavity filled with thick fluid that cushions the ends of the bones and reduces frictions as the joints move. This fluid layer is contained within an outer, dense, fibrous layer, which provides some structural stability. Together, these layers form the joint capsule, which allows for greater range of motion in comparison to other types of joints present in the body, but weakens them structurally. Injuries to the joints involve damage to soft tissues, either to the ligaments, which typically connect two bones together, particularly in joints like strong, firmly attached straps or ropes, or the components of the joint capsule. This is true of victims on the rack, wherein the ligaments would bear the lion's share of the traction force, although some ligaments would be more susceptible than others. On both the bottom and top, the smaller joints are pulled in line with the limb and thus are supported by as much of their natural ligamentous structures as possible. But we must consider the shoulder and the hip separately. The shoulder is pulled through its maximum range of motion at 180 degrees of flexion. As the joint approaches the end range, the glenohumeral capsule and ligaments, superior, middle, and inferior, act as the main stabilizers of the shoulder joint, with the middle and inferior glenohumeral ligaments approaching their limit. Worse yet, for victims of the rack, the shoulder is inherently unstable, as the glenoid, the cup-shaped dish in which the humeral head articulates, is relatively shallow. A ball sitting in a shallow socket held in place by overstretched elastics.
This is Napoleon Bonaparte, and I'm going to show you how his shoulder can dislocate.
Sounds pretty unstable to me. Now, let's talk about the coxofemoral joint, the main locomotive joint of the body, otherwise known as the hip. Within the synovial joint family, there are several types. The hip, like the shoulder, is of the ball and socket variety. In contrast, you can see the knee and elbow are hinge joints, which allow for a less extensive range of motion, moving primarily in one plane only. As mentioned before, the greater the range of motion possible, the more prone to dislocation a joint becomes, and the more you need strong stabilizing structures to support it. Thus, the hip is stabilized by three major ligaments: the iliofemoral ligament, which is the strongest ligament in the body, the pubofemoral, and the ischiofemoral ligaments. These ligaments are strong to compensate for the stability that is lost in a ball and socket joint with a large range of motion. Imagine how much our movement ability would be impaired if our hips were also hinge joints. When considering which joints in the legs give out first, it is a competition between a weaker joint plus stronger ligaments at the hip versus a stronger joint with an extra ligament at the knee. In my personal experience, it's not looking good for the hips. When we perform a hip arthroscopy procedure, we dislocate the hip by putting traction on the leg. Can you say luxation? That just means a complete dislocation of an anatomical part. Worse yet, when a victim is placed on the rack, their legs are often pulled towards the bottom corner of the device, stretching them into slight abduction. So while the knee is pulled in alignment with the limb, the hip is pulled at an angle that places some amount of added stress on the joint capsule and ligaments. During my research, I came across several accounts of victims of the rack who were carried on a chair to further torture or to their final execution. And you can see why. I doubt medical attention was forthcoming for victims of this device. Each dislocation would need to be reduced, and the associated ligamentous injuries might require surgery. We routinely create a window in the ligaments of the hip when we perform hip arthroscopy, formerly called a capsulotomy, and often repair this with sutures upon completion of the procedure to restore joint stability. However, I am guessing that there were likely not any hip arthroscopic surgical specialists practicing their craft at the time when the rack was in routine use. Okay, Remember earlier when I said severe bleeding wouldn't occur until very late in the racking process, as it left the victim's vital organs intact, and wouldn't cause severe bleeding until very late in the racking process.
You know what? I did say that.
Well, I'm not entirely sure what would be the next thing to give out, but once the hip and shoulder joints have been dislocated, the ligaments therein would be more likely to tear completely off the bone, and once that occurs, it's mostly just skin offering resistance. The nerves and blood vessels would likely not provide much resistance at all. And since the muscle bellies are situated around the long portion of the bone, they would likely provide little resistance either. If the torturer intends to take it to the point of dismemberment, then the rack could be lethal. Once a limb is ripped clean off the body, bleeding out is only a matter of time. Listen, to be honest, if that's where I'm headed, I'd rather get it over with quickly. As depicted in the TV series The Bastard Executioner, to be quartered by horses would apply greater traction forces to the limbs than one would experience on the rack in only a fraction of a second, the very moment the chains or ropes become taut. Again, due to the ball and socket nature of the joints, I would expect the dislocation and detachment to occur at the shoulder and hip. As the gentleman on the Beast Hub podcast put it,
horses, they may seem like nice animals and everything, but no, they're pretty savage in real life.
And I read on horserookie.com that an average horse can pull 1.5 times its body weight over a long distance. For shorter distances, this number may go up considerably. 6 times the horse's body weight, or even more, depending on the breed. The ultimate tensile strength for tendons and ligaments range from approximately 50 to 150 megapascals, as reported by Bruce Martin in Skeletal Tissue Mechanics. So here's a question for my math-inclined interns. If a 1,200-pound horse is running at 40 miles per hour, how handily will human ligaments be decimated? Post your answer in the comments section, and as always, show your math.
4 horses are being ridden by someone, so 4 horses around this person, and then simultaneously they all start running.
Of course, as mentioned here on Beast Hub, there's more than one horse. I imagine this variation, where the victim is not supported by any sort of surface, would yield a more crude result. If the horses aren't pulling at a similar speed, the victim could be jerked about and limbs torn unevenly. What if a leg remains intact, pulling the mutilated body through the dirt behind it? For those of you wondering, a limb that is torn from the torso would be much harder to reattach than something severed by a clean cut, due to the irregular manner and lengths in which all of the tissues were severed. Okay, interns, take a deep breath. If you clicked on this video, you know where we're headed. This diabolical device had many names throughout its history. The wooden horse, the mule, the Spanish donkey, or apparently in Italian,
ball breaker stand.
Leave it to the infographic show to inject a little humor into an otherwise terrifying punishment.
Those soldiers condemned to take a ride on the mule were told they must ride the rail until they could take no more.
These men were forced to ride the rail up to 2 hours a day for several days at a time, which was sufficient to permanently cripple many of those subjected to this punishment. Obviously, the reproductive organs stood no chance to such prolonged pressure. One 2015 case study submitted to Sports Health by Dr. Michael T. Freehill et al. Tells of a college basketball player who suffered a testicular rupture under what they estimated to be 50 pounds of force. A 50-pound force is needed to rupture the protective outer tunicle albuginea after direct force. The testicle ruptures when force is applied through the organ that is trapped against the bony pelvis, protective cup, or inner thigh. Unfortunately, victims of the ball breaker stand were likely heavier than that. As mentioned in the study, the soft tissues trapped against the bony pelvis or inner thigh would be in acute danger here. In men, this is the scrotum, penis, testes, and even urethra, the tube through which urine is expelled from the body. In women, The vulva, inner and outer labia, and clitoris are at risk. This device could easily rob the rider of their fertility. All of this would be exacerbated by the addition of, say, spikes?
The torturers would sometimes embed spikes into the top of the triangular prism, and often the person who was being punished was naked.
We're now looking at penetrating trauma to the perineum and outward components of the reproductive system, bleeding and infection, as I doubt these devices were thoroughly cleaned in these sensitive regions of the body. Thankfully, the major femoral artery that supplies the groin region with blood is sufficiently out of the way, but even lesser blood vessels could cause fatal blood loss if left unchecked for too long. Now, even before the addition of the ankle weights, as you saw in the thumbnail, damage to the 3 pelvic bones is a distinct possibility. The 2 halves of the pelvis attach to the sacrum at the sacroiliac joint, and to each other in the front at a joint known as the pubic symphysis. These joints help your pelvis absorb some of the weight from your upper body before it travels to your lower extremities. And in women, the symphysis pubis helps separate the pelvic bones to prepare for vaginal childbirth. At the symphysis, the hip bones are connected by a fibrocartilage disc with ligamentous connectors, which allow for up to 2 millimeters of movement and 1 degree of rotation. With movement comes a degree of structural weakness. A rupture to the tissues here would allow the wooden horse to drive up into the soft tissues and organs contained in the pelvic space. Though uncommon, this injury can occur after vaginal childbirth and can lead to significant chronic disability. Pain every time you take a step. A 2014 case study published by C. Graff in the Journal of Obstetrics and Gynecology shows one method for operative fixation used to address this injury. In the X-ray, you can see the degree to which the joint has become displaced. And we can imagine the pressure that would be placed upon the sacroiliac joints as the hip bones bow outward. While a strong ligamentous architecture of 8 different ligaments stabilizes the sacroiliac joints, the torturers had ways to make the anatomy bend to their will.
Often the person would be fastened to the sharp seat and given something very heavy to hold. That, or they would have weights fastened to their legs.
Yeah. No. With the addition of weights come stories about victims being split partially in 2 through the pelvis. Oh my God. As the ligaments connecting the SI joints begin to tear and the pubic symphysis widens, the bony sacrum and coccyx at its tip come directly into contact with the triangular seat. This is brutal. Fractures in this region typically occur through sudden blunt force trauma, but extended periods of mounting pressure could cause the bones to crack.
Okay, I see what you did there.
If left untreated, any of the 3 aforementioned injuries would be enough to disable a person. With every step, the weight of the torso is transmitted through the pelvis onto the leg in contact with the ground. Even when sitting down, these are load-bearing structures which cause pain when compromised. What could be worse than this, you ask?
Didn't ask.
The Judas cradle. A sharp triangular spike fashioned from wood or metal. The victim would be suspended above the spike and lowered onto it, sometimes slowly, sometimes quickly, and sometimes repeatedly, at the discretion of the torturer, of course.
Depending on the height at which the person was hung, they could do more or less damage.
As you can see in this illustration from Draw the Life YouTube channel, the hands and feet are bound and the body suspended so that the anus is directly above the sharp point. Unfortunately, this seems to be the most common application of the device, though I did come across other created versions. Once sentenced to the Judas cradle, there was no real best case scenario. Let me explain why this is a death sentence. The term epithelium refers to the layers that line hollow organs and glands, and there are several types of epithelial tissue depending on its intended function. The anus is lined with stratified squamous epithelium, a slightly more substantial form of epithelial tissue, usually tasked with protection against microorganisms from invading underlying tissue and or protection against water loss. Beyond the anus, which measures about 1.5 inches, the rectum is lined with the same columnar epithelium that lines the majority of the gastrointestinal tract's secretory and absorptive areas. which is, mind you, much weaker. Neither of these outer membranes offer sufficient protection against the judas cradle, and once the tissue has been ruptured, bleeding would be profuse, since there are many blood vessels that converge around the rectum and anal canal. Once enough blood is lost, the body enters hemorrhagic shock, which is a form of hypovolemic shock in which severe blood loss leads to inadequate oxygen delivery at the cellular level. This causes the process of energy production within the cell known as cellular respiration to become anaerobic, meaning that it occurs in the absence of oxygen.
Tell me how I'm supposed to breathe with no air.
The main byproduct of this form of energy production is lactic acid, and your cells really don't function well when they are filled with lactic acid. High levels of lactic acid in your bloodstream is not usually a good sign. When lowered slowly onto the spike, the victim would have the chance to clench the muscles of the buttocks, the gluteus medius, maximus, etc., to slow their descent. But ultimately, the result would be the same. The attending torturer had many methods to guarantee it.
One of those was to rock the person from side to side.
And of course,
sometimes oil or grease was used to make the passage of the spike into the person that much easier.
And here's something else to consider.
We also can't find any record that the chair was ever washed.
Infection, infection, and freaking fection. This is as close to a guarantee as I've ever encountered. Even if you were the first victim to be lowered onto the judas cradle, the bacteria from your anus and rectum would be enough to cause infection in the nearby tissues and blood vessels, especially as penetration worsens and more of them are torn. And I highly doubt that any of the people to be tortured were given a bowel prep before their procedure.
We're not sure what the worst part of the whole experience would be, the pain or knowing that you're the 100th person to get the worst seat in the world.
But if the cradle was never washed or sanitized, we're talking about the blood and bacteria of the previous victims as well. Sepsis is the body's extreme response to an infection, wherein an existing infection triggers a chain reaction throughout the entire body. Eventually, this causes septic shock or a dramatic drop in blood pressure that can damage the lungs, kidneys, liver, and other organs. In severe cases without treatment, this is fatal.
It could be hours or whole days. Sometimes a weight was added to the legs, increasing the pain.
Did I mention that most of what we discussed earlier about the dislocation of the bones that comprise the pelvis also still applies? Only here, the organs in the pelvic space are more susceptible since a sharp point is fishing around inside them. The weights aren't even necessary. But hey, what's torture without a little added pizzazz? If you'd like to see another installment of this video series, let me know what devices or methods I should cover next down in the comments below. If you haven't already, be sure to check out the first installment where we covered the infamous brazen bull. Remember to check out my online gym, Human 2.0 Fitness, for free right here on YouTube, where we help you prevent injury and move better. If you liked the video, be sure to give it a thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.